I'm Dr. Payal Mukherjee. I'm an adult and paediatric ENT surgeon with a special interest in hearing and balance disorders. I work at the Sydney ENT Hearing and Balance Centre, which is located at the Sydney Adventist Hospital. So this is a model of a patient's skull, the middle part of the skull containing the two ears, and this is sort of the inside of the skull where the brain sits and where the spinal cord goes out of. And it's amazing the amount of detail we have of all of the minute structures where the nerves run out of the skull. This is, as you can see, it's clearly very high resolution, and it's attained from just a normal CT scan. This is part of a research project of mine involving 3D printing, and right now I'm exploring the uses in clinical practice in preoperative counselling, preoperative planning, in education of our medical students, and also the large part of the research grant is looking at bioprinting, which is the ability of using 3D printed technology and combining that with molecular biomedical engineering to be able to print living tissue. So be able to 3D print a patient's bone or 3D print cartilage, so a patient's ear, for example, which is particularly exciting because it's custom made for the patient and it's not a prosthesis, it's living viable tissue, and it's done to, and particularly for that patient with microtia where they didn't have an ear formed, you can imagine the benefits of it rather than having numerous surgeries that have failed and not given a good cosmetic result. The bulk of the 3D printing work like this has been viable from a grant an award that I won from the Sydney Local Health District. I'm an academic at the Sydney Adventist Hospital, but also at the Institute of Academic Surgery at RPA. So it's in collaboration with both of these units. So the clinical drive is from the SAN, and a lot of the developments are happening in collaboration with colleagues at the University of Sydney, at the IAS, and also some colleagues at the University of Wollongong. And that's where the bioprinting work is really happening. So it's not there now, it's in the laboratory phase now, because there's a lot of steps towards developing it. So we've got to firstly look at 3D printing appropriate scaffolds where we can put stem cells that then, generate into these living tissues. There are other ways of looking into this, such as being able to inkjet print layers of cartilage on top of each other. So that's we've got to do that first in the lab, and then once that's successful, we've got to translate that into an animal model and do experiments on animals. And after that's been successful, then there's the clinical testing in humans. So it probably is at least 5 years away. But I really have to thank the Garnet Pass and Rodney Williams Memorial Foundation for funding this bioprinting grant, and it's being run through the Sydney Adventist Hospital. I suppose in the long term, what we would like to see is that when a patient comes with a particular disorder that needs to be, or defect that needs to be filled, or whether it's a congenital deformity in the ear or a defect in their jaw, that we will be able to customize a model to their own anatomy. So when we do the reconstructive work, we're able to print either bone or cartilage that's gone from the lab straight into the patient's ear, and it's their tissue, so they're not going to be rejecting it. The benefits of that is for the patient that, although it's not available now, I'm very hopeful that this is going to be available in the near future, maybe in 5-10 years. But the benefit of that is it's firstly the patient's own tissue, it's not a prosthetic, so it's not going to be rejected. You don't have the donor site where normally when reconstructive surgeons do surgery, they have to get graft off somewhere, whether that be the leg or the tummy. They have to get bone and fat and tissues from somewhere, and that has a significant morbidity of itself. So we're able not to be able to do that. We can, for example, harvest a little bit of their fat, culture those fat cells in the lab, get the stem cells out of that, give them signals to turn into cartilage, put those stem cells on a scaffold that is 3D printed, but it will absorb away, leaving those natural stem cells in a bony formation that's customized to that patient's anatomy so it looks natural. So before we generate a 3D printed model, we end up getting a 3D model on the computer. And those models can be published on a free app that students particularly, or patients, can access through their iPhone, their iPad. So it's the ability to use existing technology but make it more efficient. We can also, apart from the 3D generated model, we can include in that lecture notes. We can include in that, little arrows that come up when the person puts the iPhone or the iPad on that particular image, that gets triggered either by a QR code or a lecture session. We can add in videos. We can put the lecturer's picture next to it. So there's the ability to do so much, and we're actually doing that as a research project, to help a research project, to look at undergraduate teaching at the University of Sydney, which is particularly advantageous for the students like on the campus of the SAN, which is a bit remote considering Sydney University in Sydney traffic is at the other end, is at least an hour's drive sometimes. So it really helps students access that learning remotely and even in their own home, or even when they're on country rotations, when they're in hospital. So it's the ability of making anatomy teaching more engaging and more accessible, and help the students get the best marks at the Sydney Adventist Hospital.